Hello and good day everyone. My team and I will be taking you on the antibiotics used in the treatment of cough. Now what is cough? Cough can be defined as a common reflex action that clears the throat of mucus or other foreign irritants. Now many causes of cough can be linked to minor illnesses such as common cold, whereas persistent or severe cough can be linked to or could indicate the presence of bacterial infection which will require an antibiotic treatment. What are antibiotics? Antibiotics are a class or group of drugs or medications that help in the treatment of diseases caused by bacterial infection. They work by killing or inhibiting the growth of these microorganisms known as bacteria. Now my team and I will be taking you on 3 antibiotics used in the treatment of cough. One would be azithromycin, the second would be augmentin, and the third would be ceftriaxone. I'll be taking you on the therapeutic indications of the 3 listed drugs. 1. Azithromycin. Azithromycin is an antibiotic that is used in the treatment of bacterial infections or diseases caused by bacterial infections. We have 1. Respiratory infections, example, bronchitis and pneumonia. We have sexually transmitted diseases such as chlamydia and gonorrhea. We have skin and hair infections, and we have certain types of malaria or other parasitic diseases. 2. Augmentin. Augmentin is indicated in the treatment of diseases caused by bacterial infection. Example, respiratory infections such as sinusitis, bronchitis, and pneumonia. It is indicated in treatment of skin and soft tissue infections. Example, impetigo and sinusitis. It is indicated in treatment of strep throat and tonsil infection. Also indicated in treatment of dental infections. Example, periodontitis. 3. Ceftriaxone. Ceftriaxone is indicated in the treatment of diseases caused by bacterial infections. 1. Respiratory tract infection. Example, bronchitis and sinusitis. 2. Sexually transmitted diseases. Example, gonorrhea. 3. Urinary tract infections. 4. Skin and soft tissue infections. Example, abscesses and sinusitis. Then the last one, severe infections. Example, sepsis and meningitis.
For completion of these drugs, azithromycin. Each film-coated tablet of azithromycin contains 250 mg of azithromycin with an excipient of a known effect such as lactose, which is 5.13 mg. Augmentin contains amoxicillin and clavulanic acid. The amoxicillin contained in augmentin is about 600 mg per 5 ml as trihydrate, and the clavulanic acid contained in augmentin is about 42.9 mg per 5 ml as potassium salt. The excipient used in augmentin is strawberry flavored excipient. Ceftriaxone AFT 500 mg contains 500 mg ceftriaxone and sodium per vial. Ceftriaxone AFT 1 gram is contained in 1 gram of ceftriaxone and sodium per vial. Ceftriaxone AFT 2 grams is contained in 2 grams of ceftriaxone per vial, and the excipient used is sodium, is 3 mg.
Now we'll be discussing the appropriate dosage of these drugs. For azithromycin, children should take 10 mg per kg for the first day and 5 mg per kg for the next 4 days. For the adults, they should take 500 mg for the first day and 250 mg for the next 4 days. The duration of this drug is once daily for 5 days. For augmentin, children weighing more than 40 kg and adults should take 1 gram for every 12 hours for severe infection and 625 mg for every 12 hours for mild infection. While children weighing less than 40 kg should take 20 to 40 mg per kg for mild infection and 40 to 90 mg per kg for severe infection. The duration of this drug is 7 days. Ceftriaxone injection, adults should be given 1 to 2 grams once daily, and children should be given 50 to 75 mg per kg once daily. The duration is 5 days.
Discussing on the pharmacology of this drug, for azithromycin, azithromycin works by inhibiting the bacterial closure synthesis, leading to the bacterial death. It is absorbed rapidly in the gastrointestinal tract. It has high volume of distribution. It's metabolized minimally in the liver and it is excreted unchanged through the urine. It contains amoxicillin and clavulanic potassium. Amoxicillin works by inhibiting bacterial cell wall synthesis, which leads to bacterial death, while clavulanic potassium works by inhibiting bacterial enzymes such as beta-lactamases, which causes antibiotic resistance in bacteria. They are absorbed rapidly in the gastrointestinal tract. They have high volume of distribution in the body fluid and body tissue. They are metabolized in the body for amoxicillin, while clavulanic potassium is metabolized extensively in the liver. And most of is excreted or changed through the urine, while chlorinated potassium is excreted as metabolized through the urine. Ceftriaxone works by inhibiting bacterial cell osmosis, leading to bacterial death. It is not absorbed orally because it is administered either intravenously or intramuscularly. It has high volume of distribution in the body tissue and in the body fluids, such as the cerebrospinal fluid, and it is metabolized minimally in the liver. The excretion is done either in the renal, in the bile, or in the physics.
Ceftriaxone are known for their effectiveness in treatment of cough. However, it's important to understand the precautions as for azithromycin, patients with allergies to macrolides or Phology should avoid using this drug because it can cause severe or life-threatening conditions. Azithromycin can also increase the risk of heart problems. If you're talking about things like blood missions, shortness of breath, or also irregular heartbeats, consult your doctor. It's also important to consult your doctor before combining azithromycin with other drugs, and also remember to what's called eating. Patients with allergies to penicillin should avoid taking this drug because it can cause severe reactions. Pregnant women should also be careful when using this drug because augmentin can puncture the placenta and affect the unborn child. Augmentin also interacts with warfarin, especially in patients with impaired kidney or liver, and this can cause an increase in bleeding. Patients that are allergic to penicillin or cephalosporin should avoid taking this drug because it can cause severe reactions. Ceftriaxone can also cause severe diarrhea, and this is an indication of secondary infections. Breastfeeding mothers should also take note of this drug because it can pass into breast milk. It's also important as well to avoid taking this drug with calcium-containing solutions, and also in newborns with hyperbilirubinemia because it can cause bilirubinemia encephalitis, which can lead to serious conditions like hearing loss, brain damage, and even death.
The interaction of these antibiotics with other drugs and their side effects. Antibiotics can interact with other drugs in many ways, affecting their metabolism, their toxicity, and their efficacy. Here are some key interactions. Firstly is antacid. Antacid can interact with these drugs, affecting their absorption of these antibiotics. Second one is statin. Statin can interact with these drugs, increasing the risk of adenolysis. The next point is alcohol. Alcohol can interact with these antibiotics by causing GI discomfort and weakening the immune system. The next one is the side effects of these antibiotics. The side effects include nausea, vomiting, diarrhea, and allergic reaction.
It's important to understand the contraindication of these drugs in order to ensure patient safety and also effective treatment. For azithromycin, patients that are hypersensitive to azithromycin, macrolides, and also ketamine should avoid taking this drug because it can cause severe reactions which can be life-threatening. Also, patients that are with hepatic dysfunction should also avoid taking this drug because it can worsen the renal condition leading to liver damage. Patients that are allergic to any penicillin should not take augmentin because this can cause severe reactions which can affect your health. Augmentin is also contraindicated with patients with hepatic dysfunction because augmentin can worsen the liver condition which can lead to liver damage. Patients that are hypersensitive to ceftriaxone or any other beta-lactam antibiotic should avoid taking this drug because it can cause severe allergic reactions. Neonates. Ceftriaxone should not be used in hyperbilirubemic neonates because it can raise the level of bilirubin in the blood, which can cause brain damage. Ceftriaxone should also not be mixed with calcium-containing solutions because this can lead to precipitation of ceftriaxone calcium salts, which can block blood vessels.
I'll be talking about overdose. Overdosing on these antibiotics that is used in treatment of cough can have several adverse effects. The first one is toxicity. High doses of these antibiotics can lead to toxicity, affecting various organs like the heart, the kidney, and the nervous system. The second one is the side effects. The common side effects of this antibiotic overdose are vomiting, nausea, and diarrhea. The next point is resistance. Misuse and overuse of these antibiotics can lead to antibiotic resistance, which will make it harder for future infection to be treated.
In conclusion, the antibiotics discussed by my team and I are very crucial in treatment of bacterial cough. It is essential to use them judiciously. However, it is also vital to follow the proper dosing and duration for this drug to avoid resistance and side effects from them. In addition, these drugs should be used when prescribed by a healthcare provider to avoid antibiotic resistance and also for effective treatment. Thank you for your attention, and click on the link below to download the ebook to this presentation and subscribe by clicking on the bell icon to stay updated on our future content. Thank you once again.